For weeks, the world's health officials have said you don't need to wear a mask in public if you're not sick, but now that message seems to be changing. Some experts in some countries are now encouraging it or even making it mandatory. So what should you do? Joining me with his thoughts is infectious disease specialist Dr. Jeff Kwong. Doctor, really great to talk to you. It's an important topic. In Austria and the Czech Republic, it is mandatory to wear a mask outside your home. Officials in the U.S. are now strongly encouraging it, and the World Health Organization is taking a second look at it. So what should we be doing here in Canada?
Well, I think first and foremost, we need to ensure that there's enough supply of masks for our healthcare workers. And right now, I think there have been announcements that there are more masks coming, but I think that is first and foremost what we need to ensure. And then we need to ensure that we're also continuing our current physical distancing measures, because that is definitely the most effective strategy to prevent infection. And I think if you can have that, I think that, the strategy is maybe adding the masks on after as an additional weapon against this virus. So masks are not 100% effective. They probably have some effectiveness, so they'll probably help to prevent some infections. But I think the most effective thing is to continue the physical distancing.
Doctor, do you think that the reversal, in some cases it's a complete reversal in terms of perspective on masks, do you think it has something to do with perhaps not fully understanding the virus from the beginning or the spread of the virus from the beginning?
Yeah, I think we were learning a lot about the virus. And so, at first we thought, you'd only be infectious when you have symptoms. And now we're learning that people can be contagious even before they start showing any symptoms. And there's lots of people who may not show any symptoms at all. So I think, knowing that now, I think it does make sense to add masks, to try to prevent spread from those who may not realize they have any symptoms yet. From spreading it to others. And I think, if you use physical distancing properly, if you do it properly, you should not be spreading it to others anyway. So I think, the masks are just a supplemental strategy for times when you might not be able to do your physical distancing as best as ideal.
A lot of people we see on the streets who are wearing masks just aren't wearing them properly. What is the risk of not wearing them properly? And how do you know that you're actually getting proper protection from a mask?
Yeah. So that's a very important point. You have to wear it properly. It has to cover your nose and cover your mouth. And the idea is that you have to try not to contaminate yourself when you're putting on or taking off your mask. So you have to wash your hands before you put them on and also before you take it off. And try not to touch it because, the more you touch it, then the greater risk that you could be increasing your chance of infection because you could be introducing the virus onto the mask or onto your face and then getting infection that way. So I think it takes a bit of discipline to not touch your face and not touch your mask when you are wearing the mask.
And let's end on this point, reminding people that if there is one mask and it has to go between a frontline worker and somebody who is just sitting at home, it goes to that frontline worker each and every time. Dr. Jeff Kwong, thank you very much.
Okay, you're very welcome. Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.